Physical changes after stroke. We will cover the following 8 topics in this module. We will review some of the more common physical changes that can affect a person after stroke. Stroke is complex, and this discussion is not intended to cover all of the impairments you may be experiencing. If you have any questions about how a stroke has affected you, please discuss this with your healthcare team. The brain is the control center of your body. It controls how you think, feel, communicate, and move. How a stroke affects a person depends on many factors. Where the stroke happened in your brain, or the location of your stroke, is one factor that determines how your body is affected. The effects of stroke are different for each person. They can be mild, moderate, or severe. Problems with strength, balance, and movement are some examples of physical challenges after stroke. These can improve over time, especially over the first year after a stroke. Generally, the longer the time from the stroke, the smaller the change you can expect, and the longer it takes to achieve this change. The effects of stroke can leave one side of your body paralyzed or weakened. Weakness is caused by damage in the area of the brain that controls the signals for movement and the areas that communicate these messages to your body. Weakness happens when your brain is unable to activate or control your muscles. It is not a problem with the muscles themselves. Weakness after stroke is usually on one side of the body and is the most common effect of a stroke. Weakness can affect your face, your arm, or your leg. It can also affect the muscles that control your trunk or your body. These muscles may be affected in combination with one another, or the weakness may only affect one area of your body. Weakness after a stroke can pose challenges to your independence. Weakness can make your body difficult to move, affect your independence, and can cause you to fall. Weakness after stroke is also called hemiparesis. Another problem you may experience after stroke is a change in your muscle tone. Muscle tone is the slight tension that is always present in muscles, even when the muscle is at rest. After a stroke, muscle tone can increase or decrease. The amount of tone that you have in your muscles after a stroke can change over the course of your recovery. If tension in a muscle is decreased, it is called low tone or flaccid. It will feel limp and heavy. If the tension in a muscle is increased, it is called high tone or spasticity. It will feel tight and difficult to move. Muscles may feel stiff and resist being stretched or straightened. Spasticity is common in the arm, foot, and/or ankle on the stroke-affected side. It may be accompanied by muscle spasms, pain, and difficulty performing your personal hygiene activities, like washing your hands or under your arms. The shoulder is a very mobile joint. It is the most mobile joint in the body. There are a number of structures which work to help stabilize it, including muscles, tendons, and ligaments. If you have low tone in your shoulder, or if it is flaccid, that means that the structures normally working to help hold your shoulder in place aren't working. These changes in muscle tone can make the shoulder less stable and at risk for injury. For example, low muscle tone around the shoulder joint can lead to shoulder subluxation, a partial dislocation of the shoulder joint. This condition starts when the muscles around the shoulder become weak or paralyzed after stroke. Due to gravity pulling down on the arm, the humerus drops from the socket because the muscles cannot hold it in place. Change in muscle tone, movement, and control can also lead to a stiff, swollen, and painful shoulder, hand, or wrist. It is very important to handle, move, and position an affected limb carefully to help avoid injury to joints, muscles, and ligaments. There are strategies that you can use to prevent shoulder injury. Do not pull on it. Don't let your arm hang loosely, and make sure your arm is supported when you are seated or in a resting position. Talk with your healthcare team about how to position your arm to protect it, reduce pain, and promote recovery. Proper positioning of your arm, leg, or body after stroke is important to prevent pain or injury and promote recovery. On the screen, the first picture shows a person lying on their unaffected left side. In the second photo, they are laying on their affected or right side. So in the first photo, the affected right side is supported on pillows to encourage comfort, to keep a natural position, to prevent swelling, and to be visible to the person after stroke. The leg is slightly bent and supported by a pillow for comfort and to prevent swelling while maintaining good alignment at the hip and knee. In the second photo, the affected right arm is positioned slightly forward to prevent injury and promote awareness. The stronger or unaffected left side is supported on pillows to encourage comfort and functional use. In the third photo, in a seated position, the arm is visible and supported either on a tray, an armrest, or often with pillows. The affected leg is supported on a footrest or comfortably on the ground. This helps to encourage natural stimulation of the affected limbs and promote recovery while decreasing the risk of injury. The key messages are: support your weaker arm. It is important to change position often. It protects your skin, prevents pressure areas from starting and skin breakdown, and helps to keep you feeling comfortable. It's okay to lie on both sides when resting, but you may need help turning in bed and to change your position. We've just talked about how proper positioning is important to comfort and can prevent pain. Pain is common after a stroke. There are different types of pain. Pain can be local, for example, coming from the joints and muscles. Shoulder pain after stroke is an example of localized pain. Central pain is caused by damage to a specific area of your brain, where sensations such as touch or temperature are misinterpreted by the brain as pain. This is less common. Speak with your doctor and healthcare providers about strategies to manage pain. Examples of strategies could include exercise, medications, and positioning. After a stroke, a person may experience changes in their sensation. These changes in sensation may include one type of symptom, like numbness, or maybe a combination of several changes in sensation. These could include numbness, tingling, pain, the inability to detect temperature changes or tell hot from cold, a loss in the ability to sense where your body is in space. This is known as proprioception, or changes in taste, smell, or hearing. Balance is the body's ability to remain upright, and it involves coordinating our bodies with our surroundings. Changes in balance after a stroke are common. Problems with your balance can leave you feeling dizzy or unsteady. When balance is affected after a stroke, a person is at an increased risk for falls. After a stroke, you may experience what is called ataxia. Ataxia is a medical term that means a problem with coordination. It is caused by a stroke in the lower part of the brainstem, called the cerebellum. Ataxia can cause difficulty with targeting, reaching, and controlling movement. This can make it difficult to eat, perform daily activities, and walk. People with ataxia often have tremors in their arm, their legs, or their body. So, what can you do? Talk to your therapist about strategies to help with weakness, tone and spasticity, protecting your shoulder, pain, sensation changes, balance, and ataxia. Fatigue is one of the most common effects experienced after stroke. Recovery after stroke takes a lot of energy as the brain recovers and people with a stroke begin relearning functional tasks. Fatigue can cause feelings of frustration, sadness, and anger. It is important to allow yourself the time to rest, recover, and heal by getting enough rest and keeping a sleep schedule, taking short rests or breaks throughout the day, eating and drinking well, planning your day, and prioritizing tasks and activities, continuing with the activities you enjoy, and staying physically active. Remember the 4 P's of energy conservation. Prioritize your activities. Plan your day. Pace yourself. And position your body in the most comfortable position. Today we have talked about weakness, changes in muscle tone and balance, ataxia, pain and changes in your sensation, and fatigue. This can all happen after a stroke. All of these changes can make you at risk for having a fall. So here are some strategies that can help you prevent a fall. Ask for help when needed. Ensure you are wearing supportive and stable footwear. Wear glasses if prescribed. Use your cane, walker, or mobility aid. Watch for spills, loose rugs, and potential hazards that might lead to a fall. As we have discussed, there are many physical changes that can occur after stroke. You are an active participant in your recovery, and there are steps you can take to address these changes. Be as physically active as possible. This will improve your strength, walking ability, coordination, and balance while preventing falls. Physical activity can be incorporated into everyday activities, such as your personal care, and it has both physical and emotional benefits. Use your weaker arm or leg as much as possible. For example, use your weaker hand to stabilize objects. Make sure your weaker arm is always properly positioned. Keep it in contact with a supportive surface, such as a table or armrest when sitting, and well supported with pillows as needed when lying down. Work with your physiotherapist and occupational therapist to identify your goals and work together to achieve them. Ask them for activities and exercises you can do to work towards your goals for recovery. If you have questions or want more information, please talk to a member of your healthcare team.